Hello, dear listeners. Welcome to another episode of Follow Your Path. Today, we will be talking to Dr. Jonhan Ho. He is the Division Director of Dermatopathology at the University of Pittsburgh Medical Center. I am joined by my co host, Meredith Herman. Welcome to the show, Dr. Ho. So,
Thanks. Go ahead.
yeah, starting off,
Sorry.
sorry, I'm just going to ask you the first question. Tell us about yourself, where you grew up, where you went to school. How did you end up in dermatopathology?
As you said, I'm the director of dermpath here in the Department of Dermatology at UPMC, and I'm also the dermpath fellowship program director. And I guess I grew up in the Midwest, my way through Chicago and Ohio, and finally to Pittsburgh, and that's as far east as I want to go. I firmly planted roots here. It would take a lot to move. Would take a lot of effort to move. We would have to move a whole bunch of stuff that I've accumulated, and a whole bunch of animals and a whole bunch of kids and stuff. So uh, it's it would take a lot of work. So a lot of work to move. So that's why I'm not going to move anymore. I'm here for good. But anyways, I ended up here. I came from a small program, just 2 residents a year of pathology, and then I ended up here doing pathology informatics, just because I'm a huge computer nerd, and also did derm path here. So that's how I ended up here. I thought I was only going to stay a few years, but I ended up staying for it's almost 2 decades now. So getting up there. I can't hear her.
Yeah, Meredith, we can't hear you.
Sorry. So thank you for sharing that story and how you got into pathology. We know that mentors are a big part of helping people into pathology, and we are wondering, is there a particular faculty member or mentor that inspired you along your journey to dermatopathology and choosing pathology in general?
Yeah, so I would say I had two kind of major role models or mentors or people that really influenced what I am today. And I would say the first one was in medical school, and his name is Robert Brodell, and he's a giant in the field. And I didn't know how much of a giant he was, and still is. He's been the president of the American Academy of Dermatology. So this dude is is just a machine. He had his own private practice. He saw like 100 patients a day, like just in and out, in and out, in and out. And then he signed out pathology after that. Like he signed out dermpath. He had his own dermpath lab, and he signed out like I don't know, 50 cases a night. So all day long, 100 patients. Then he would sign out dermpath, and you would be like, well, that's not a really good work-life balance. But he did it all. His wife, ophthalmologist, same office building, so they shared some staff, but had separate areas. And I think he had 4 or 5 kids. I think he had 5 kids. His office building was connected to his house, so his kids would pop in and pop back out, during sign out or whatever. And sometimes, he would leave to take care of, drive somebody to somewhere else or something like that. And he just did it all. And then on top of all that, he told me this story. So he was like, when I graduated, my parents said, you should do something for the community. So he was like, okay, what should I do for the community? And he ended up doing, I can't even remember what it's called, but like a walk for cancer. And he ended up being in charge of this multi-million-dollar charity too. So this guy did it all, and he was just so enthusiastic about everything, well published, and he would just be excited about a case, and he would be like, oh, that's the case, and students would come to him and get inspired and get published, and want to love to do dermatology and derm path. So I'll never forget he told me, he pulled me aside one day, and he said, you may forget everything that I said, but don't forget this one thing. And he said, always try to be perfect. He goes, you can't be, it's impossible, but you should always try to be perfect. And so I've definitely not been perfect, and I've definitely not always tried tried, but I tried to always try, if that makes sense. We keep in contact to this day, and today so this tells you something else about him. When he retired, quote unquote retired, he took his dream job, which was to start a dermatology residency. So now I believe he's at the University of Mississippi. So now he's the chair of dermatology at U Mississippi. So he moved down south and still very active in the AAD and stuff like that. And then my second mentor, not in any specific order, just in chronological order, I guess, not definitely not in order of importance, is my dermpath fellowship director, and his name is Drazen Jukic. So if you've ever met this guy, everything about him is a good time. Like, he just has good time. He's like 6'2" or 6'4" or something like that. Just this huge dude, and just got a Croatian guy, and just got this gregarious personality, and this everything was funny, and you just couldn't help but laugh and have a good time when you were with him. So I trained here, and he took a chance on me. Taking me as a dermpath fellow, because I came from a small place, and he took a chance on me, and I've always been thankful for that. But I knew I wanted to do dermpath, but when I signed out with him, I really knew I wanted to do dermpath, and probably half of it is the topic, and the other half is just because I just saw him having, we would crack jokes all the time around the scope. We'd be here late, and some people might be like, "Oh, that's so toxic, you were that late," or whatever. But we just had such a good time, just chatting back and forth. And it wasn't always just us two. We had rotators coming in, and people would want to stay late just because it was just such a good time. So, and then sometimes we would go out to happy hour and then have extend our good time. So those, and I just learned so much from him, but he's just such a great guy. I just feel so lucky to have met Drazen and Bob. So I would say those two.
Oh, great. That's wonderful to know. So, in your opinion, what makes dermpath unique? Like, if someone, for example, a junior resident or a medical student wants to pursue dermpath, like, what makes it unique?
So dermpath is unique because from the rest of pathology, because you really have to know, not that you don't have to know this in the rest of pathology, but you really have to have a good handle on the clinical presentation, the patient as a whole. So, and this is definitely not a fair assessment, but a lot of other pathology is majority tumors, majority neoplastic. And a lot of dermpath is inflammatory rashes, so to speak. As a matter of fact, in the origins of dermpath, Bernie Ackerman used to say that nobody wanted to do dermpath, so dermatologists had to do it. As a matter of fact, in the beginning, before it paid a lot of time and it was a good lifestyle, nobody wanted to do dermatology because it wasn't very fancy. You weren't a big surgeon, and you weren't a big internal medicine guy. It was kind of a little bit of both. And the joke was that in dermatology, if it was wet, you would dry it, and if it was dry, you would wet it. And the pathologists didn't want to deal with the rashes, so they loved the tumors, and so the dermatologists were like, okay, nobody's looking at these, so we have to look at it. And that's kind of how it started. I mean, there were pathologists and dermatologists that kind of helped found the whole field. But that's what I say. Clinical presentation is super, super important, and a lot of path residents have trouble with that at first, and there's a little learning curve, but they find that to be very cool because you have to look at the picture, you have to talk to the clinician. And the other thing that I really like, probably the thing that I enjoy most, is that the dermatologists are very, very sophisticated in dermpath. So a significant portion of their boards is reading slides and making diagnoses. And that's why you can come into dermpath fellowship through dermatology residency or pathology residency. So I really enjoy that they know their stuff, because it keeps me on my toes. And when we pour our heart and soul into these reports, and we have these very sophisticated and complicated differentials and things that we say, I feel like they can appreciate it. Whereas sometimes when I was in path residency, and nothing against surgeons, of course, but sometimes I felt like if we made a fancy diagnosis, they'd come back and they'd be like, well, did I get it out or not? And it's like, come on, man. I just made this super rare diagnosis, and that's all you're going to give me. So I feel like that's there's a lot of depth in the clinician pathologist relationship. And it all comes from that they had a lot of derm path training. So we have the derm residents in here every week, for unknowns, and we split them up between the juniors and the seniors. And so we really get to know them, and they're really interested in the path, and they come by, the attendings and the residents, they come by and they want to see their biopsies, if it's just out of interest, or if it's just out of, that this is a difficult case. So I would say that's probably the biggest difference in derm path. And to be honest, I wish more subspecialties did this. I know they do that a little bit in hemonc, but I wish more other residencies like GI, GU. I wish they could go into fellowships, pathology fellowships too, because that would only strengthen the relationship and the collaboration between the two fields. So that's probably the biggest difference. There are others too, but derm path is typically a quick workflow. We might see 100 cases a day, and it's like opening, I don't know, is that the right analogy? Opening a box of chocolates. Like in heme path, you might open up a box of like 10 chocolates, but they're big, huge pieces of chocolates, and if you don't like it, you still got to eat the whole thing. But in derm path, you might open up a box and it might have 100 pieces of chocolate, and to get to the next one, you just pop a bite in. If you don't like it, you just move to the next one. And sometimes you get to one piece of chocolate that's really, really yummy, and you can take your time eating that chocolate. You can save it for the next day if you want to. You could save it for 2 weeks if you want to. You could do next gen sequencing on it if you wanted to. But it's a quick workflow. It's very visual, and that's why dermatologists are good at it too, because derm is very visual. Most of the time, you recognize the diagnosis, within, a second of slapping the glass down on the stage. But then you also have some of the cases that you have to spend a little more time in them, and it's like a little puzzle. So it's a little bit unpredictable, and unpredictability is one of the types of in the theory of gamification, it's unpredictability is very important. So it's like winning the lottery. You're like, whoa, I didn't know I was going to win the lottery, and it's like a pleasant surprise. So that's how I would characterize derm path.
I like the analogy with the box of chocolates. I really enjoyed that. So thank you for sharing that. And I'll use that analogy going forward as well. So speaking of interesting cases and rare cases and the box of chocolates, as you say, can you share a case that you found most interesting or impactful in your career?
So there's one case that stands above it all, and there's multiple aspects to this. So this was probably, I think this was 2014, so almost 8 years ago or so. And I think it was in the late spring. And me and my fellow Yarrick, he's now at Johns Hopkins, we were just cranking out cases. I think it was at like 7 p.m. at night. And it was really busy, and it was late, and we're just kind of having a good time. And then so he's at his desk, and I'm at my multi-head scope. All of a sudden, I put this stat case, like a consult from an inpatient, onto the stage, and like I said, immediately you usually recognize whether you do know it or whether you don't know it. At least those two bins. And as soon as I put it on the stage, I was like, I have never seen anything before like this in my life. Like I knew there was just nothing I'd ever seen before. Um, and I was like, Yar, come look at this. And we looked at it and we were like, this has to be viral. Like it had viral inclusions, like in the epidermis, but not like any other viral infection that we had ever seen. And he was like, yeah, I've never seen anything like this before. So we were like, whoa. And he was a transplant patient, and it just had like these balls of dyskeratotic cells, like really round, like in the stratum corneum. And so we were like, we think it's viral. So we just typed in like virus for any, and we ordered like every single stain that was available to us in the lab. And we got them back like the next morning. And it was positive for the BK virus stain. So we're like, BK, that doesn't make sense. Usually a kidney thing. And so we read a little bit about what it stains. It turns out it's a pan polyoma virus stain. So we're like, okay, so this is a polyoma virus. And not to get too deep into the weeds, but we ended up having, I emailed that evening. I emailed later that evening, emailed the two people that were polyoma virus experts at the university, and one of them was Yuan Chang, and she got back to me first. And she it turns out, I had no idea who she was. She's huge in the cancer oncology, the viral oncology world, huge name. And so to make a long story short, again, she was able to sequence it all and tell us that it was a variant of polyomavirus, human polyomavirus 7, that had not been reported to cause disease in skin before. So, we ended up publishing it, and all this other stuff. But she had contacts at the NIH and et cetera, et cetera. But that by far is the coolest case that I've ever been a part of, because it kind of takes us through the whole sequence of like H&E diagnosis, and then we did electron microscopy, then we did IHC, and then we did sequencing, and we nailed a totally new disease. So I thought it was a real nice story for all of what the purpose of academia is. We have all these people here together that can help discover and kind of help prove that it's a new disease.
Nice,
So,
wonderful.
so,
Wow.
Hmm.
so
Yeah,
me and Yark will prefer, and Dr. Chang, Yuan Chang, will be forever tied to
nice.
that one event.
Wow. Wonderful, wonderful. So, moving on to a slightly different topic, what do you think is the most gratifying aspect of your job?
So the most gratifying aspect of my job, I would say, personally, or kind of for posterity, or both.
Both.
So
Let's do both.
um, I think I could tie it all together. Is so I'm trying to capture it all into one word,
Right. You can use more words. I mean,
and this is not going to be the perfect. This is not going to be the perfect word, but I would say, and maybe it's like a couple words, but just meeting people and learning about people and learning things from people. So two words: meeting and learning. Like you guys both rotated through dermpath, and I learned a lot from you guys. Meredith, I think you were only there for 2 days or 2 half days or something like that, and at least 25% of that was eating Chinese buffet. um, and Abdullah was here for a month, and I just love hearing about other people's stories. I love hearing about other people's perspectives. I love hearing about people, um, and how things are changing, because you guys have new perspectives. I'm an old man now, and I'm used to certain things, and that's why I love to have kids, because they see things from a completely new perspective. What we thought were smartphones and are a new thing, they're like, smartphones were invented like way before I was born. And what was the funny thing that I read on Twitter the other day? It was about a movie that came out in the 90s, something that we might consider fairly recent. And somebody young said that, yeah, this movie came out, it was written in a paper. This movie that came out in the late 1900s. I was like, what? Come on, man. Like it was from a thousand years ago. So I think it's super important. History repeats itself, and it repeats itself for a reason. And it's very frustrating when mistakes happen again and again. They just have, Mark Twain said that history doesn't repeat itself, but it rhymes. And it's because we don't connect these generations. So the same thing kind of happens over and over and over in a different flavor. And old people always say that young people have it too easy, and young people always say that old people don't know anything. It's like, why is that? It's because we don't connect these generations. And so I think it's so important to get to know everybody's stories, whether you're older or whether you're younger. And that's how you pass along knowledge. That's how you pass along information across generations. So that might be why I love it so much, is because I get new perspectives, and I get to pass along like my perspectives too, so that we don't continue to make the same mistakes. And this is important in medicine, especially because there's such quick turnover. 1 year you're out, 3 years you're out, and then there's a whole new generation, and then people forget what happened, and people just get used to this new normal. So we should use that to an advantage, so that we can move things along faster. But we should also watch out that we don't forget what happened last year, so that we there's unintended consequences, or that we forget that some things happen that we shouldn't repeat again. But that's probably why I like that meeting and learning so much, is because there's so much value in seeing other people's perspectives. And we can hand off knowledge, from one to the other, both ways, in person better. And that's something that I think we need to make easier, in the digital world.
Yeah, great.
Absolutely. And I totally agree. We can all learn from each other at all levels of training. And that's what's great about medicine. We got a medical student, fellow, attending, and, we're all learning in all different directions. So that's a very good point you bring up, Dr. Ho. And so
Yeah,
speaking of,
everybody.
yeah,
Yeah, sorry. Just everybody has something to contribute, and everybody has something to pull out. Like medical students, we're a little bit too hierarchical in medicine. Like medical students are always like, I don't have anything to say. I don't have anything to teach anybody. But you do. At the very minimum, you can teach those who are where you were, just a year ago. But like I said, there's many things that can be exchanged, and same for attendings. Even if you're an expert in one thing, you're not an expert in everything. So that's why that's the name. That's the reason behind the name for the startup KiKo, is knowledge in, knowledge out. Like everybody has something to put in, and everybody has something to put out, take out.
absolutely. And I think KiKo is a great kind of thing to discuss at some point in this podcast. Would you like to elaborate on that before we move on to our next talking point?
Yeah, so KiKo is a startup that I started up a couple of years ago. I was really frustrated with how we can't just teach each other. We can't just freely share, and a lot of times we're prohibited from sharing from each other. And so I just want to bust that wide open for all doctors across the world. The vision is that anything that any doctor says to any other doctor in any capacity, whether it be hi, or peer-reviewed research. I want this to be kind of the new world that doctors use. And so right now, we have mostly pathologists on there, but stay tuned. We'll have everybody on there one day.
If I may, Dr. Ho, if someone asks me what KiKo is, I tell them that it's an amalgamation of Twitter, Instagram, and YouTube. It's Twitter, LinkedIn, and YouTube. Is that
Yeah,
correct?
I think that's a great description. When people ask me, I also throw in Wikipedia also because I think there's a community kind of curation
Yeah,
aspect to it
yeah.
too.
All right, Meredith.
Yes, so we were talking about training a bit. So can you elaborate on the training for dermatopathology? What is that like? What's the pathway? Are there fellowships, board exams, and what do they look for in applicants?
Yeah, so like I said before, you can come in either through a derm residency or a path residency, and it's fairly competitive. You have to apply early, though, although that may be changing. And during fellowship, basically, you're required to do 8 months, half time in 8 months of the other thing. So if you're a path trained, then you have to do 8 months half time of clinic, and then if you're derm trained, you have to do 8 months half time of pathology. And they rotate through the different clinics, and they also rotate through the different subspecialties like heme path, breast path, et cetera, et cetera, et cetera. And fellowship is basically you're just cranking out cases. It's a very one-on-one type of experience, kind of like an apprenticeship, and we encourage people just to see our fellows just to see as many cases as possible, and especially as many hard cases as possible, because that's where you'll really learn. That's where you'll sweat in the future. Might as well sweat while there's no consequences right now. What do I look for in a fellow? I look for somebody that can teach me something. Sometimes they have another fellowship that they come in here with, like a soft tissue or a heme path fellowship or a molecular fellowship. But I really look for the intangibles. And I don't know what everybody else looks for, but I like people who are underdogs, people who have a little chip on their shoulder, people who want to prove themselves, people who um, really love cases. I love derm path cases. Like I had one fellow who, when when he was here, when he would see a good case, he just like couldn't help himself. He would just be like, "Oh my God, this is just such," and he would just pace back and forth like, "Holy cow, I can't believe, I just saw this case." And so that sort of thing is just infectious. And when we interviewed Victoria, who actually ended up staying here as faculty for a couple of years, now she's started up her own private practice. I laid that polyoma virus case in front of her, just a picture, and she goes, "Oh my God, that's polyoma virus," and I was just blown away. Um, and she's like, "Yeah, I was reading about that, never saw," and she's like, "Yeah, I just read the journals for fun, and I just happened," and she just had this incredible memory. So uh that's when you have the right person, is when they just have so much fun looking at these cases. And what else do I look for in a fellow? I think most program directors, if you ask them a question, the first requirement is that you could see yourself signing out every day with them for an entire year. So I guess that's partially um, personality. And then I would say if you did a rotation with them, you kind of have an advantage over people who were not able to do a rotation. So away rotations are very, very important, just to get somebody to know you. But that's where I think social media can kind of help too, because you can kind of show what kind of personality you have just over the things that you happen to say. And it's hard to fake it, up to a certain volume. Like you could fake it for 10 or so posts, but like after 10, I think your true personality starts to come out. So I feel like you can, I feel like I know a lot of these people that I've never met online, through social media. I feel like through their comments and through their sense of humor and what they like to post and the jokes that they make. I think I feel like I get to know a lot of people through social media. So I think it's a little bit of an equalizer these days.
Wonderful,
Gives
wonderful.
people from smaller programs a
Yeah,
a a leg up.
yeah, definitely. Yeah, I definitely agree. I mean, without social media, I don't think I would have gotten the fellowships that I got. So I'm thankful for that. So, last question that I have for you: what advice would you give for residents interested in dermpath?
So the standard advice, of course, is to I mean, in the gaming world, basically they say get good, right? GITGUD. So the traditional way is to do a lot of publications, but there's a lot of new ways to get good now. And by get good, show that you do good things and put out quality work that shows that you're interested in a field and that you have attention to detail and that you can complete a project, from beginning to end. You can grind a reputation out, and when you collaborate with people on a project, like I would say we're collaborating now, but not just on papers, but if you collaborate with somebody, you'll meet other people who uh, your reputation will grow. Your word of mouth about how good you are will grow, and then you can meet and connect with other people. So I think those are all very important things, and I think there's a lot of creative ways to get those two things done. Like Casey Shukow approached me about a project, and I connected him with Philip McKee, and I think they're done with it now. And there might not be another way to connect otherwise. So I think there's many ways to kind of get good and grow your reputation and grow your network. So get good and get connected.
Right.
That's what my advice would be.
Awesome. That's great. That's great. Thank you very much, Dr. Ho. So, folks, that's our show for today. You can find Dr. Ho on Twitter. His Twitter handle is at for the John, Jon, and you can visit his profile on KiKo XP, of which he's the founder, as he mentioned. And thank you very much for listening to us, and we'll be back with another episode soon.
Yeah, it
Bye.
was such a pleasure. Thank
Thank
you
you.
both.
Thank you
Thank
very
you.
much,
Bye bye.
Dr. Ho.